So welcome to the HearQueer presentation. I will start this presentation with my own story. So 7 years ago, I moved to the United States. As an 18 years old gay Asian kid, I had experienced lots of social hardship. I felt I was always an outsider, both in school and social life. It caused me so much mental stress because I wasn't able to adapt myself to the new environment. I tried to look for therapists, but I couldn't find anyone who comes from the same background and was able to empathize with me. So I felt helpless and isolated. But am I the only one who had to experience these challenges? I realized I'm not alone here. So queer youths are more likely to receive poor quality of care due to stigma, lack of healthcare providers' awareness, and insensitivity to the unique needs of this community. Also, during pandemic, existing historical disparities in mental health concerns have been exacerbated by COVID-19. LGBTQ plus people's mental health has been disproportionately negatively affected. With all these issues in our community that we are facing, also being a member of this community, I am fortunate to meet a group of friends who share the same interests and wanting to contribute back to the LGBTQ community. So our team is 4 out of 5 queer, 1 straight ally, all people of color graduate student here at the University of Michigan. I'm 18 and here I'm joined with my team members, Hannah and Mangvi. So Dave and Douglas were not able to make it to our presentation today. So in order to understand this problem space better, we started with interviewing 4 stakeholders, include asexual researcher whose researching domain is in LGBTQIA+. And we also interviewed with healthcare professionals, another researcher doing LGBTQIA+ topic, and also a certified therapist who is also part of the community. And I'll hand over to Mami to go to the next slide.
So we have conducted 5 interviews. We have also created a survey, which we got 129 survey respondents. And we have also scraped a subreddit, LGBTQIA subreddit, which we got 2.5K comments. And we have analyzed it using the LIWC analysis, which I'll be talking about later. Now I'll introduce the problem space. How might we empower the LGBTQIA community in the field of healthcare by making sure that they feel empathized and heard, but keeping in mind the importance of privacy and anonymity? We tackle this problem by creating HearQueer, a crowdsourced healthcare platform bolstered by healthcare professionals, which seek to enable LGBTQIA people to have more agency with their diverse holistic health journeys. HearQueer brings together knowledge from multiple sources in order to bridge existing gaps in information access. The primary goal of this application is to connect LGBTQIA+ individuals with affirming healthcare professionals. Through this method of bidirectional communication, both professionals and service recipients have the opportunity to learn. So next, we have conducted the survey and we have also scraped the subreddit, and we have analyzed it using the linguistic inquiry and word count, which we have found that 47% of the community on subreddit has faced struggle in finding resources for mental health, and 15% in that have found it difficult to find relevant help based on their experience, their cultural background, and personal fit. Now, from analyzing all our research, we introduced Alexander, a Hispanic grad student at the University of Michigan who has recently identified himself as a homosexual and whose main pain point lies in the fact that he has not been able to identify a healthcare professional who was able to understand his LGBTQ+ needs. Now we have also done some comparative analysis with these 4 platforms, and we have found that there are no mobile applications for either of them, which reduces the number of audience drastically. They are primarily focused on medical aspects, but not necessarily in mental health domain. They also do not give access to clinical professionals, which could be hard for people to find best healthcare professionals fit that they're actually looking for. Now, hand it over to Hannah.
Thank you, Yiting and Manvi. I'll now turn to a discussion of some of our design considerations, as well as some of the features that we implemented. So our survey results, besides the findings that Manvi has discussed, they also indicated that respondents faced harassment on the basis of their identity, with most experiencing harassment in public spaces. So we know from academic literature about public space and privacy concerns for LGBT+ individuals that special consideration should be taken to protect their information and by extension, their safety. So LGBT+ individuals, they often have to worry about, for example, being outed accidentally and selectively managing accounts based on audience. When these audiences collide, there are often social repercussions. So based on this research, we've decided to implement a phased and toggle system of information regarding identity on HearQueer. So users aren't required to set profile photos or share their names. And once they establish connections with professionals or other users, they can choose to selectively reveal different components of their identity. So here we have the prototype of what a user like Alex would see once they open the app. The homepage is consisted of posts that are created by healthcare professionals that are meant to inspire them to engage with users more, as well as provide helpful, verifiable information, which isn't really found on a centralized platform elsewhere. The posts also allow users to connect with the providers without having a formal session, and allows the users to kind of test the waters and see if the care provider has an area of knowledge that might be particularly affirming. Another feature is that the user can also comment on posts and follow up questions, as well as engage in discussion with other users. So this allows members of the community to provide anecdotal or perhaps personal information that could help inform other members. So another key feature is the ability to browse profiles for the healthcare providers. So the profiles are supported with relevant information. We're thinking of introducing a badge system where the badges are given based on credit earned by the provider through helping patients, as well as through positive interaction with their posts, such as upvotes. And then lastly, we also want to share with you all the user profile and doctor profile. So the users are shown the questions that they have asked previously, and also the experts that they have communicated with. That way they have a personal record of activity on the application that can be used to inform their future healthcare decisions. And I'll briefly go over our timeline and budget. At the current stage, there are startups that have similar ideas, but they don't have the same potential for open interaction as our project. So with this unique method of bidirectional communication, we want to set a precedent for this type of connective healthcare for LGBTQIA communities. So we hope to pilot within 5 months and expand within a year. And then here's a breakdown of our project budget. Hopefully funding that we get from this competition will help us bring this product into reality and also help us increase the potential for quality, individualized healthcare support for LGBTQ+ community members, whether they feel fully comfortable in their identity or whether they're still discovering. And just to wrap up here, I'll touch on some important next steps that we plan to take. We definitely need to speak with more stakeholders, including getting feedback from healthcare professionals. Besides scoping out the problem space more, there could be legal or professional issues that we might be unaware of. And we'd like to interview more people from the LGBTQIA+ community. Our interviewees were somewhat limited, and we need to specifically branch out more in people who identify as lesbian, transgender, intersex, and non-binary. And then lastly, I just want to touch on the fact that we do need to do more research on online communities pertaining to marginalized populations to continue to unearth these specific challenges. Going forward, we also intend to prioritize the intersectionality of experiences through our research. So as individuals with multiple culturally embedded identities, we just want to be sure that we continue to move forward through gaining multiple perspectives. Yeah, so that wraps up our presentation. Thank you so much for listening. We really appreciate your time, and we'll now open the floor for questions.
Yay. All right, panel, who would like to start?
I can kick us off. Thanks so much for your presentation. As I mentioned before, at my work right now, I'm doing health equity work, and it's definitely an important challenge for us to ensure that all of our patients across identity are able to find the support that they need and to feel seen and be heard and be empowered in their care. So thank you so much for the time that you're putting into addressing this challenge. One question that I would love some more clarity on, can in like one sentence, maybe two, can you like specifically target what your app is solving for? My takeaway was that as a user, the user is coming to the app because they are either looking for a provider who really understands LGBTQ plus identifying individuals and can provide that care, or they're looking to connect with other peers who understand their health journey. But I'm not super clear, so I'm wanting a very clear statement about what your app is solving.
Yeah, so
You're on mute, Hannah.
Wait.
oh, wait.
Okay, yeah.
Okay. Okay, sorry about that. We're still getting used to the Zooming. So I would say that that was a very good summary of what HearQueer essentially does. So the two things that make us stand out from other platforms such as Reddit or Quora are that the professionals are verified. And so as you said, someone would be coming to this application with the intention of finding someone, connecting with other community members. And then lastly, if we go back to the problem space diagram, we also have this added dimension of beneficial anonymous lurking. So this is for people who may not feel so comfortable being out in their identities, but still want information on a private platform.
Thank you.
Apologies if I missed this. What is your business model, or how are you generating revenue?
So the two major ways we are generating the revenue, one is through the advertisement, and the other way is we're trying to do this kind of a subscription plan, which charge $2.99 and increase in the future.
Okay, who would be like the advertising target?
So it can be lots of nonprofit LGBTQ organizations or some other social groups that are trying to, as far as I know right now, lots of groups, they trying to organize the events, but they are not able to reach out to more target audience. So our platform can be a resource for them to do that.
Great, thank you.
So on the healthcare provider space, and so you mentioned, so on one of the things I'm thinking about is just the challenge of health systems having a wide number of providers who really understand LGBTQ plus patients. So I'm curious, are you partnering with individual providers, so like a private practice, or are you thinking of connecting to health systems that are larger? And just curious what that model is, like individual providers or networks of providers.
So at this moment, I think that's the field we definitely need to look into more. Right now, our team are thinking, there are lots of existing healthcare providers. They are volunteering at nonprofit organizations, and we are hoping to connect with them to see if there will be potential a larger healthcare professionals user base that we can, able to bring into our platform to start with.
Do you have anyone on your team right now that's healthcare focused?
No, none of us are in the field.
Okay.
When you guys highlighted the kind of competitive landscape, this may be more of a clarifying question, but you highlighted that the existing kind of players are more focused on, you said medical or finding specific healthcare needs, and that HearQueer was focused a bit more on the mental health resources. Throughout the rest of the presentation, the word healthcare showed up, and I don't know if that was interchangeable with the same kind of healthcare that these existing partners or existing players provide, but maybe to provide a bit more distinction between the kind of healthcare that the existing landscape partner or people, organizations partner with versus the kinds of partners who you guys are looking to have on the platform.
I can take this. So technically healthcare is like a broad thing, and mental health kind of goes inside. It's like a subset of it. So we found that a lot of these competitors like Volkswagen, for example, like is very focused on drug distribution for queer people and like erectile dysfunction and other sorts of things in that area, but not necessarily for mental health. I think the point is none of them have been very focused on mental health also. Our platform gives both, right? So we connect with doctors, therapists, nurses, anyone who wants to give their time for any kind of consultations or anything. So I think that is where we come in. We kind of even emphasize on mental health, but these don't necessarily do that. If that answers your question.
That does. And then I think I'm not a health professional, but or in the field, but I think then throughout the presentation, highlighting that is the kind of healthcare, and then what are the kinds of organizations that you would hope to have on the platform, and kind of what are the channels, whether they are through existing partner networks or nonprofits or private practice who focus on that, I think would be a great way to highlight what differentiates you and how this can best support the community.
This is kind of like a give and take kind of a thing, I would say, because we are motivating even like healthcare professionals from already established hospitals and areas like that, because they come into our platform and then they are certified. They tell that they're from this clinic, and if they're really good, if they're doing a good job, then they get the customer base too for them. So it's kind of like a give and take kind of thing also. So that's how we were kind of thinking about it, but that's probably going to be more foundational for our next steps.